Primary care is considered to be the first access to any type of medical care. And so there are different types of primary care physicians. There are internal medicine physicians who take care of adults. There are pediatricians who take care of children. And then there are family physicians who take care of adults, children throughout the span of life. So we are a type of primary care physician, fairly comprehensive, what we say from cradle to grave, taking care of babies, taking care of pregnant women, taking care of adults, and people in the later stages of their lives as well. The path to becoming a physician is really quite long. Students need to go through 4 years of college and then 4 years of medical school. And then once they finish medical school and they get their medical degree, either an MD degree or a DO degree, a Doctor of Osteopathy, then they need to do a residency for anywhere from 3 to 5+ years before they're qualified to practice as a physician. Family medicine residency is a 3-year training program which follows medical school. The family medicine residency has been here at the HealthAlliance Hospital, Kingston Hospital, prior to that, since 1979. We have graduated in excess of 175 physicians who have become family physicians. Approximately 30% of those actually practice in the area, so it's been a major source of family doctors for this area. In order to provide a family medicine residency program, we need to meet certain requirements that are set forward by what's called the ACGME, which is the Accreditation Council for Graduate Medical Education. And that includes both the environment of providing the care, the specific curriculum, and we have very specific curriculum elements, how much adult medicine, how much pediatric medicine, how much behavioral health, that type of thing, and also the faculty. What's really nice about this training program in Kingston is that this is the only residency in Kingston, New York. There are no other surgical residencies, there are no other internal medicine residencies. The physicians in Kingston, New York, and that includes the specialists as well as the primary care physicians, see the residents as their own trainees. And physicians love to teach. And so our physicians in the community, whether they're cardiologists or neurologists or surgeons or psychiatrists, take our residents under their wings, and we provide that opportunity for them as well. The benefit to the community is enormous. Part of what I'm certain that you've been reading about, because it's been all over the news, is the shortage of primary care physicians. It's really hard for small communities in non-metropolitan areas to recruit physicians. Younger doctors want to go to cities, and the best approach to recruiting physicians is to grow your own. So we grow our own here. The advantage to the community is that you've got a very, very robust group of doctors who are newly trained and very well trained who are providing care. The advantage to the physicians in the community, for the specialists, is that these are the source of referrals for their patients. And part of the advantage for them in training our physicians is they want to have their impact upon the way that our physicians think about some of these specialty problems as well. So it's a very well integrated system involving the patients, involving the doctors, and involving the primary care doctors, involving the specialty doctors as well. I think that our program is actually fairly unique compared to other family medicine residency programs, and that's part of the reason that I think we've become much more competitive in terms of attracting really highly qualified residents. So as I mentioned to you before, we participate in the Teaching Health Center program, which is unusual and unique. The fact that our residents are employed by the Institute for Family Health and not by the hospital is also unique. Well, what's great about the HealthAlliance is it's a well-integrated community hospital, and since most primary care physicians are going to be working out of community hospitals, it provides that degree of training. Since our residents are the resident physicians, it gives them the opportunity at all different levels of care to be working in the hospital. And on top of that, we have other access to resources such as the resources on the Mary's campus, the radiology resources, the psychiatric resources, the medical library, etc. I think it's a fabulous place to train physicians. I think our doctors, when they come out, are really well trained in all aspects of family physician, what we call full spectrum family medicine.